My point of view is that everyone on estrogen or testosterone should take an aspirin, baby aspirin, in the morning and evening. And this will do the following. One, a major side effect of hormone therapy is clotting. That is because, as you heard from Melinda, there is an increase in protein production in the liver caused by both estrogen and testosterone. Second, the major side effect of hormone therapy is clotting. Heart attacks, strokes, DVTs, and pulmonary emboli. And when you do the analysis of hormone therapy plus aspirin, no one has done that trial, so we're doing it all from the data on aspirin alone and hormone therapy alone, and I'm just combining them as if they were additive. We don't know that, but that's the best guess. You see that those decrease. A second major side effect of hormone therapy is increased endocrine-sensitive cancers, breast mainly. Those are decreased substantially by aspirin therapy. Thus, you could take care of that problem. And the third is a baby aspirin in the morning and evening decreases both to make the benefit-risk analysis for bioidentical estrogen alone or with non-acetated progestin and testosterone much more favorable to the beneficial side. So what we're doing is taking the data that Melinda presented for the Women's Health Initiative and the Kaiser data on testosterone. Those are the largest studies, and I'm going to show you what the net effect would be if you added aspirin. Now, the goal in all of this is longevity still. So I want you to come back to, I'm not treating symptoms, although it does do that. We're just looking at outcomes for longevity, heart, brain, skeleton, and happiness. And if you will, so it's looking at the basic saying, can you cut down on the possibility of aging? So hormone therapy may be forever beneficial for both men and women if the pretreatment levels are low, and aspirin is needed to keep those on hormone therapy younger. So the data, this is the Women's Health Initiative, the 18-year follow-up that Melinda talked about, and the earlier follow-up. So if you look at heart attack risk, and you'll see how minor this is. This is 1.09 is the risk, statistically significant, but there were 3 more heart attacks per 10,000 years. That's 0.3 per 1,000. That's 0.03%. And if you multiply it by, say you take it for 40 years, from age 50 to 90, that's only a 1.2% risk of a heart attack by taking this for 40 years alone. Same thing for stroke. Again, it's 5, so not much more. Breast cancer, 9. Again, 40 years, that's a 3.6% risk. That's from 40 years. DVT, deep vein thrombosis, is the high one. Pulmonary emboli also increases, but the mortality rate, as Melinda said, the all-cause mortality actually goes down. If you just look at this, you'd say, it's crazy that the Women's Health Initiative was stopped early because of side effects when, in fact, their mortality rate did not go up. If you look at the estrogen alone as it's impacted by aspirin, the first one was the estrogen and progestin, the methylprogesterone acetate. I'm going to make a major point, as Melinda did, but I'm going to highlight it even more. The acetate was a very bad choice in the women's health study because, as you'll hear, it screwed up the estrogen vascular benefit. That was found after it was put in the study. So it was very good laboratory data that it did that, found 2 years after. Why did they use Prempro then? because it was the major thing used by women at the time, and secondly, because the company offered to give it free to the NIH for the study.